Good afternoon, everyone, and welcome to our Campus Health Town Hall. My name is Lori Lozon-Clabo. I'm the Dean of the College of Nursing and the campus's Chief Health and Wellness Officer. Before we get started today, I wanted to give you just a bit of an update on where we stand in terms of the coronavirus pandemic. Many of you have heard nationwide cases are generally declining across the country. Michigan seems to be lagging a bit behind that decline. Michigan as a state is still considered to be at high risk level. Our weekly number of cases is for the most recent week is 273.1 per 100,000 population, which is well above the threshold of 100 per 100,000 population. Test positivity rate in the state is 10.6%, which is again above the threshold of 10%. And these data are for the week of September 28th through October 5th. In the city of Detroit, positivity rate is 4% and has been stable for the past 12 days. On our campus, the positivity rate is 2.8%, which is well below any of our trigger metrics. And for the first time this week, we saw a slight decrease in the raw number of cases since the semester has started. In terms of our COVID vaccine mandate, I wanted to give you a bit of an update on where we stand. As of today, of those faculty who are scheduled to teach an in-person class this semester, 98.2% are fully compliant with our vaccine mandate, meaning they're either fully vaccinated or have an approved health or religious waiver. For students who are taking on in-person classes on campus, the rate is 95.2%, and for staff, 93.7%. These are really impressive numbers, and I think as a community, we're to be congratulated for our public health efforts. Just a reminder that once again this year, we will be requiring the flu vaccine. The date to upload your documents or to request a waiver for the flu vaccine mandate is October 20th. And in order to upload your documents or to access a waiver request for the flu vaccine, which is slightly different than the waiver for COVID, please go to wayne.edu/coronavirus/vaccine-mandate. Scroll to the bottom of the page, and you'll have great direction there as to how to find the form, upload the form, or upload your documents. We have lots of questions today, excuse me, about boosters, about our quarantine and isolation protocols. So we're going to get right to questions. I want to introduce our two panelists joining us today, both from the Campus Health Committee. First, Dr. Ramona Benkert. Dr. Benkert's been on the faculty of the College of Nursing at Wayne State since 1998. She's served as the Associate Dean of Academic and Clinical Affairs since 2015. She is a member of the Campus Health Committee. She is also a practicing adult nurse practitioner with over 33 years of experience working in nurse-managed clinics and clinics for the uninsured. Dr. Marcos Zervos is Assistant Dean for Global Affairs and Professor of Medicine in the Wayne State University School of Medicine and Division Head of Infectious Diseases for the Henry Ford Health System. Dr. Zervos' area of practice and research is in epidemiology and public health. He coordinates global health projects to build sustainable capacity in low-income settings in over 20 countries, excuse me, most recently working with the city of Detroit in its COVID response and vaccine research and deployment. So I'm going to get us started right away. Dr. Zervos, there's been a lot of talk about the booster shot for Pfizer, but what about those of us who got Moderna or J&J? Should I get a Pfizer booster shot? Should I wait?
No, thank you. That's a really important question. The answer is that you should wait. It is within the next few weeks, the CDC, ACIP, the Committee for Immunization Practices is going to be meeting to talk about boosters for Moderna and J&J. What we know about J&J is that with the second dose of the Johnson & Johnson vaccine, there's a 94% efficacy at preventing infection and 100% efficacy at preventing hospitalization, serious infection, and death. And there's about a 7-time boost in antibody response. So it's very highly likely that the ACIP is going to recommend a second dose of the J&J vaccine. And for Moderna, the studies have just been submitted or have been submitted recently to the FDA, and they're likely going to be recommending the booster shot in the very near future also. So far, or at least as of now, it's just the Pfizer that is recommended. And if it's been 6 months since the last Pfizer dose, and somebody's over 65, or they're certainly, if they're immune compromised, if that's even earlier, you should get it at 28 days after. But if somebody is working in a high risk setting, healthcare, first responder, has chronic disease, then the booster is recommended at this time currently only for Pfizer for the after 6 month dose.
Thanks for that. Dr. Benkert, as we're talking about flu shots and boosters, is it safe to get my COVID booster shot and my flu shot at the same time?
Yes, it is. The CDC suggests that you can get both vaccines at the same time. And even though both vaccines can be given at the same visit, people should, of course, follow the recommended schedule for either vaccine. So if you are still within your window, for example, getting Pfizer or Moderna, you should stick to that schedule and not try to do them both at the same time. And if you haven't gotten your currently recommended vaccines for COVID, we, of course, as you can imagine, are continuing to recommend that, and ideally get the flu vaccine by the end of October or October 20th, which is our deadline here at the university.
Great. Thank you. Dr. Zervos, if I don't get a booster shot, am I no longer considered fully vaccinated? And what protection do I still have from COVID?
Yeah, so we've learned a lot about the vaccines, and we know that they've remained safe and they've remained effective. But what we have seen is that after about 6 months, the antibody levels start to drop off, and we have seen infections. And so instead of the 94-95% efficacy for Pfizer, Moderna, and a little bit less for Johnson & Johnson, we've seen breakthrough infections, or we've seen infections in people who've been vaccinated. And so now that the efficacy of preventing infection has gone down to, maybe 70-some%, and again, a little bit less for Johnson & Johnson. The vaccines, however, remain effective at preventing hospitalization and serious infection and death, but they have been shown to be less effective in preventing infection overall at about 6 months or later. And this is the rationale for the booster shot. What is still undetermined, though, is how long the antibody levels last. And even if the antibody falls off, there's cellular immunity that can also kick in and can prevent serious infection. We are recommending the boosters out of abundance of caution and because we're starting to see these breakthrough infections. But to answer the question, one should consider themselves vaccinated if they've received at this point either 2 doses of Pfizer or Moderna or the 1 dose of J&J. The recommendations for additional doses and boosters are changing, and we need to keep up with that and we need to follow. But the answer is that we should consider ourselves fully immunized. People, however, that are immune compromised, that have underlying disease, that are over 65 years of age, that are in high risk occupations, they're at higher risk. And although we are immunized and protected against serious infection, the recommendation for boosters is there, and it should be followed. So and that again is out of abundance of caution to prevent infections as much as possible. In terms of are we going to need boosters annually? That remains to be seen, but it is highly likely that we are going to need to get boosters on some sort of a regular basis. But what that depends on is how much COVID we're seeing in the community. So if we're seeing very high levels of COVID in the community, like we're seeing now, then the boosters are going to be needed more often. If we're not seeing, very much COVID or COVID rates go down significantly, then that recommendation for the interval of boosters will be a little bit longer.
Thanks, Mark. Dr. Benkert, one of the questions I get almost every day is about isolation and quarantine protocols. So here's a question that's a variant on that. If I haven't been vaccinated, but I've had COVID in the last 90 days, do I still have to quarantine if I've been exposed again?
Thank you for that. And yes, we get a lot of those questions at the Campus Health Center too. I just want to say first, quarantine means you've been exposed to someone and you are protecting yourself and others by being safe and staying away from people who may not be vaccinated. Isolation means you have the disease and you are protecting yourself by staying closed in a room or somewhere away from individuals. But to answer your question, you should quarantine if you've been in close contact with someone. And close contact, if you recall, is within 6 feet and a cumulative total of at least 15 minutes over a 24-hour period. And even if you've had COVID in the last 90 days, we do ask that you quarantine if you're not fully vaccinated, because as we know, we don't have sufficient literature yet to know what your antibody protection level is, even if you've had the disease. The vaccine is the best thing to be able to get, but we will ask you to quarantine even if you've been with COVID in the last 90 days.
So two variations on that I hear a lot are from faculty. One is there was a student in my class who developed symptoms and turned out to be positive. And why are we not moving the whole class online? And I think one of the things we forget is that is what we did last year when we didn't have a vaccinated community. But now the CDC recommendation is that if I've been exposed, a significant exposure, as you've defined it, but I'm fully vaccinated, I do not need to quarantine. Only those who've had a significant exposure and who are not vaccinated need to quarantine, correct?
That's correct. And I'm really glad you brought that up, because we also get that question a lot from faculty. They are unsure. And because of HIPAA protection, we can't tell a faculty or even another student either who the person was or when it might have happened specifically. So we make the determination privately with the individuals whether they're a contact or not. And if they're fully vaccinated, they do not need to quarantine. They can still come to your class and be around others if they're fully vaccinated. If they're symptomatic, that changes the story, and we begin a process of evaluation that's for isolation or quarantine.
And we do always notify a faculty member when there has been a positive case in their class.
Yes, we do, because we have a process in which anyone who's had a positive case in their classroom on campus, we send out a generic letter to the entire class after we've talked to the faculty to let them know that there was a person, although they're not close contacts, there was a person in the class who was positive for COVID.
Great. Dr. Zervos, is it true that the rapid tests aren't as reliable in detecting the Delta variant? So this person says a family member tested negative on a rapid test, but then had a PCR test and was positive. I, the person asking the question, also tested negative on both tests, but I had the exact same symptoms. Could I have had COVID?
Yeah, so almost everything that's circulating now is the Delta variant, and we do know that the rapid tests are not as sensitive as the PCR test. So it is very possible to have a negative rapid test and a positive PCR. It's also possible to have a negative PCR test and have COVID. It is partly related on how symptomatic somebody is or not, when the sample is obtained, how good of a sample was done. So and the amount of shedding of the virus does vary over the course of somebody's illness. And usually when they're first symptomatic, that's when the level of the virus would be the highest, or they have a fever. So it's unusual to have a negative PCR in somebody with COVID, but it is possible. And if the symptoms are identical, then asking for a second test is appropriate.
Great. And just a reminder that testing is available at the Campus Health Center, as well as at pretty much every local pharmacy and through your healthcare system. Dr. Benkert, if I've been exposed to COVID, how soon should I get myself tested if I'm fully vaccinated? And should I still quarantine until I'm tested? This is the question we just asked.
So people who are fully vaccinated do not need to quarantine after contact with someone who had COVID unless they have symptoms. However, fully vaccinated people should get tested. Currently, CDC says 3 to 5 days after their exposure. I guess based on what Dr. Zervos just said, if you're symptomatic, you're probably likely should get your tested as soon as possible so that we can capture, in case it's a Delta variant, we capture that virus right away. But if you're asymptomatic, you can wait 3 to 5 days after your exposure if you don't have any symptoms. Of course, you should wear a mask indoors in public for at least 14 days following the exposure, or until you have a test that says it's negative.
Great. Thank you. Dr. Zervos, we're going to ask you to bring out your crystal ball. Do you think that the COVID vaccine will be made available for 5 to 11-year-olds in time for them to be fully vaccinated prior to the holidays?
Likely, yes. It is. There's the Pfizer vaccine is a little bit further ahead in the clinical trial, so likely that will get approved in children I think in the very near future. Moderna is a little bit further behind, but I suspect that certainly by the end of the year, we'll have vaccines, probably both vaccines approved in children. So far, the studies that have been done in children have not identified any major safety issues. They're well tolerated. We're part of the Moderna trials in pediatrics, and the children are tolerating the vaccines well. They're not, actually, I think the adults that I've seen, the adult studies have had more reactions than the children have had, and we get the reports on major safety kinds of issues, and so far the vaccines appear to be safe in children, and they're very much needed. I suspect that we'll get Pfizer in the near future and Moderna by the end of the year.
We know that'll be a great relief to many members of the campus community who have young children trying to attend school in person.
Right.
This is another child-related question. I've heard that kids present different symptoms when it comes to COVID. So do I only get my child, my son or daughter, tested when they're coughing? What if they have GI issues? What if they have some sort of non-specific illness? When do you recommend getting them tested?
Yeah, that's a hard question, because it's there's a lot of viruses that can cause very similar illness, but COVID can cause fever, it can cause cough, it can cause just cold-like symptoms. It can present with GI kinds of symptoms, but especially if somebody has any kind of respiratory symptom or fever, then they should get tested. If it's just GI, then usually no, they don't need to be tested for that.
Thank you. So next series of questions are about sort of campus logistics, and I'm going to ask Dr. Benkert a few of these. Ramona, what precautions or recommendations do you have for a student who walks into a desk in a classroom that was just dismissed from another class? Should they bring their own cleaning materials? Should they clean their desk? How do they manage that space?
Well, I think it's important to first point out, and it's a good question because we've been asked that a lot also. It's a really good question, but it's important, I think, to stress right up front that COVID is primarily spread in three main ways. Breathing in air of someone who you are in close contact with who's infected, inhaling those small droplets, having those small droplets or particles land on your eyes, your nose, your mouth, especially if it splashes or sprays like from a cough. And then lastly, touching your eyes or nose or mouth if they've been exposed to the virus. Primary safety measure, I think, for all students and faculty and staff is to keep your own hands clean and to use hand sanitizer. Surfaces, often fomite surfaces, are not really proven to be significant vectors for this transmission in which the virus is spread. But if you're concerned, you certainly need to wear face masks indoors. We all know that that's one of the protection mechanisms. That's one of the reasons why. And we also have our janitorial staff cleaning areas and surfaces every day, the frequently touched surfaces. If you feel very, very concerned for yourself, such as maybe you have a chronic illness or something that you're worried about, you certainly could clean off your desk with a hand sanitizer wipes or some hand sanitizer surface just for your own protection. But just know that those kind of surfaces are not really significant vectors. It's really the droplets that are in the air, which is why we're having the mask mandate.
Great. Let's talk about flu vaccine. Why is the flu shot being required for faculty, staff, and students again this year?
Well, the primary reason is that the CDC believes that we're likely to have a very heavy flu season this year, and the virus that causes COVID-19 can be spread at the same time as the flu virus. And so, given that many places, including here in Michigan, have relaxed some of their COVID-19 mitigation measures, such as, we have kids in school, people aren't staying at home, they're using restaurants. There's a risk for you to be exposed to both viruses simultaneously. And so our goal really is to keep you safe from at least the flu vaccine or the flu virus as well as COVID. So that's why we're recommending it. We would like our campus to stay safe and you to stay safe by having both vaccines in your system.
Yeah, I wouldn't forget that, flu remains a very serious illness, and usually even under, usual year we'll get hospitalizations and we get deaths as a result of flu, especially in vulnerable population. It was nice that we didn't see it last year, and that was probably because of the distancing and kids staying home and masks, hand sanitizer and everything else. But we do have the expectation we're going to see flu this year, and that makes the flu vaccine very important. And so to get flu and on top of that COVID would be, particularly serious infection.
And I think also when we talk about public health or community health measures, it's incumbent on us as a community to attempt not to overwhelm our healthcare systems. And the notion of dual circulating respiratory illnesses could be really problematic for bed space and bed availability in our hospitals in the state, and particularly in the city of Detroit. So, Dr. Benkert, if you don't get the flu vaccine, same consequences as if you don't get COVID?
Similar consequences. We will, though, allow all faculty, staff, and students will be allowed to submit a medical or a religious exemption as they were allowed to do for the COVID vaccine. Again, our goal is to keep the entire campus safe. But yes, if you do not follow through with the mandate, the same sort of exemption or, recourses will occur if you have not gotten the flu vaccine.
Great. I'm going to take these last two myself. One is, do we have any plans in the near future to eliminate the indoor mask mandate? We are all so tired of wearing masks indoors, and it's wearing on all of us, I think. But we also recognize the importance of indoor mask wearing, especially in areas where transmission is considered to be substantial or high. And Michigan, as I mentioned in the earlier statistics, still ranks as an area of high community transmission. We at Wayne State extended our mask mandate through mid-October, and the Campus Health Committee will be looking at data again next week to make a recommendation regarding the mask mandate. But given the data we've seen thus far this week, I would be very surprised if we were to relax the mask mandate as early as mid-October. We're going to continue to stay on that data. And once we get below that level of substantial transmission, I think we're all anxious to be able to be mask-free indoors. But we're in a marathon, not a sprint, and we're not quite at the finish line yet. Dr. Zervos talked about watching levels of community transmission. And as soon as we get closer, we'll all be very happy, but not yet. And I think because we're all tired of wearing masks, it's more important than ever to remind ourselves to do that whenever we're in a public indoor space, and certainly anywhere on campus in an indoor space or outdoors when we're in crowded conditions. The last was any plan to eliminate the campus daily screener soon. And that one is a definite no. The campus daily screener is our best method of allowing us to do early contact tracing when anyone has a presumptive or a confirmed case of COVID-19. And the screener has been incredibly helpful in our ability to reduce outbreak on campus, to eliminate the development of what we call clusters or spread from an individual case to a larger group. And for the foreseeable future, we'll continue to use the Campus Daily Screener as a very important tool. We are coming to the very end of our time together today. I want to thank both Dr. Zervos and Dr. Benkert, not only for joining us today to answer your questions, but also for all of the work that they do every day as part of the Campus Health Committee and their important work in keeping our campus safe. I know we're all grateful to both of them. I want to thank you both. And then I thank all of you for joining us today. We'll be back again. If you have questions, please make sure that you submit them to healthcommittee@wayne.edu. We're happy to address those questions in a subsequent town hall or by email where we can. So thanks again, everyone. Have a great afternoon and rest of the week. Take care.